Hi, this is Dr. A with a clinical chemistry review video. We are going to look at the posterior pituitary and more specifically at oxytocin and vasopressin. Alright, the posterior pituitary hormones, so these are going to be oxytocin and vasopressin. The posterior pituitary is an extension of the forebrain. It represents a storage region for oxytocin and vasopressin. And the hormones, oxytocin and vasopressin, are released by impulses from two neurosecretory tracts that connect to the hypothalamus. So again, these is a representation of the neurosecretory tract. They're connected to the hypothalamus. So a nerve impulse will travel down, and depending on the impulse, which tract it runs down, it'll either release oxytocin or vasopressin. Oxytocin is a cyclic nonapeptide, so it has 9 amino acids with a disulfide bridge connecting amino acid residues 1 and 6. I consider it the love hormone and the childbirth hormone. It is released also during orgasm, so it's a bonding hormone. It allows partner bonding, and it also has a critical role in lactation and allows bonding between mama and baby. It likely plays a major role in labor and parturition, which is childbirth. Synthetic oxytocin, such as Pitocin, is used in obstetrics to induce labor. It has been shown to have effects on the pituitary, renal, cardiac, and immune functions. And then vasopressin, which is also antidiuretic hormone, is a cyclic nonapeptide. It is structurally similar to oxytocin with an identical disulfide bridge. It differs only by 2 amino acids, so change 2 amino acids and you go from oxytocin to vasopressin. It is also called antidiuretic hormone, or ADH, arginine vasopressin, or argipressin. The major action is to regulate renal free water excretion and water balance. So again, it's moving water without moving sodium and stuff like that. So the job of antidiuretic hormone or vasopressin is to reclaim water from the renal tubules and collecting ducts and move it back into the circulation. It is a potent pressor agent, so it's a nerve reflex that constricts the arteriole. That's what it means, to pressor. And it affects blood clotting also. The hypothalamic osmoreceptors and the vascular baroreceptors, so they're looking for osmolality and pressure, so how diluted or concentrated your blood is and what your blood pressure is, and those will regulate the release of vasopressin from the posterior pituitary. It is released with an increased blood osmolality, so your blood is more concentrated, indicating dehydration and the need for you to conserve water, or decreased blood volume, which again means that you probably need to conserve the water and move it from the urine back into the blood. A deficiency in vasopressin or antidiuretic hormone can lead to diabetes insipidus. It is characterized by excessive urine production, polyuria, and intense thirst, polydipsia. These are also the signs and symptoms of the diabetes mellitus, which is the sugar diabetes, which is a completely different pathology. But because they had the same signs and symptoms, they were both named diabetes, and diabetes means siphon, comes from the Greek word for siphon, which then you can think of with polyuria, polydipsia, very thirsty, peeing all the time. They're like siphons for water. And this can be remedied, by the way, with intranasal vasopressin spray in case that happens. One of the causes of diabetes insipidus could be damage to the pituitary from a blow to the head or a head trauma. All right, that is it. Thank you so much.